That's Skeeter's child. That wasn't a baby, that was my cat.
Okay, we understand. We're going to go over some Zoom etiquette or norms in just a minute, but my name is Gina Upchurch, and I'm with the program in Durham called Senior Pharmacist, and I am thrilled on behalf of a team of people to welcome you to this Zoom conference. I want to tell you a little bit about the genesis of it. I personally was in Botswana until the 19th of March, where I used to be in the Peace Corps. And so when I got back here, I had to be quarantined, isolated for 2 weeks. And the staff did a fantastic job of getting things going while I was gone, to have us do telehealth from our homes and such. But I knew the first thing I needed to do was contact many other agencies that work with older adults in Durham, whether they're governmental partners or other community-based organizations, or our friends at Duke that are working in the geriatric field. And we started talking to each other and realized we needed to connect. And so we started some Zoom organizing, and it's really come down to focusing on 3 things that we wanted to share with you. You're going to hear a little bit about all 3 of them today. The first one is that we all want to help. Now, it's obviously why we need to help. Older adults are more at risk of having complications and negative outcomes from COVID, and you'll hear about that later. So we felt like we needed to help, but we didn't, many of us started our own databases and we weren't sure where to go for updated information. So we wanted to make that better, and we wanted to consolidate some of that. We'll talk a little bit about that. The second thing that happened was we started hearing that many people wanted to volunteer to help, or that many of us were redeploying our staffs to do telephone reassurance calls, which we'd never done before, and we really needed help doing it. And there are many people that have been in the field doing that forever that have a lot of expertise to share. So shared database, or at least have some direction in looking for information, understanding telephone reassurance, and that's what the training is about today. And the third thing was, how do you work well with volunteers? How do you deploy them well? What are the agencies that need them right now? And who are the people willing to volunteer? So coordinating volunteers. So that's really why the group started meeting. We had to give ourselves a name. So we took the Durham's Partnership for Seniors and we just named it COVID Response. So that's the group that's been meeting. We will continue meeting, and this is our first online training. So thank you so much for joining us. The second thing that I just want to talk about quickly is, why we're doing this and why the focus on telephone reassurance. I live alone, and I was quarantined or isolated for 2 weeks when I got home, but I was so fortunate. I live in my own home. I can walk out in my yard. I have friends and family that checked on me. People brought food to my house. I'm very privileged in that way and very fortunate and blessed. I think many of us on this call would be traumatized to think that we have neighbors or people that we know or we've come in contact with that feel scared, isolated, and don't know where to ask for help for something right now. The fear of that drives many of us in our work, and it's not just senior pharmacists, it's not just any one agency. All of us that have been planning this have been very passionate about this, and quite frankly, I know that's why you're on the call. So I've got my Durham t-shirt on today, and the reason I have on my Durham t-shirt is because we do things better in Durham when we work together. I'll talk a little bit about Gail Harris's Durham Way as we wrap things up today, but we know that we're better together. So I am thrilled to be partnering with the many agencies that you see listed here and the people, and we're not done yet. We're going to keep going. I'm going to introduce next somebody that's going to talk a little bit about our Zoom etiquette, and we can actually then get to the speakers. And I have been thrilled and just delighted to work with Eve Marion and Melissa Black, sort of coordinating all the back work that goes on with this presentations today, as well as the speakers, obviously. But Eve is with Duke Clinical and Translational Science Institute Community Engaged Research Initiative. They try to match Duke researchers with people in the community that have problems to see if we can do better together. I said, what can we do? And we said, we've got a job for you. So Eve, I'm going to hand it over for you to give us a little update on etiquette on Zoom. Thanks.
Wonderful. Thank you. For the next round of speakers, I've just unmuted you, and I'll be doing that as we go through the meeting. just hello, everybody. Thank you for being here. We're just going to run through a few pointers on Zoom etiquette. Some of you may have noticed that I've muted you, and I'll probably be doing that throughout the meeting if people come online and aren't muted. But just be careful because things get picked up that maybe you don't need to have one other people to hear, but just remember to mute yourself using a computer or your iPad by clicking on your picture or your name in the participant list, and then click or unclick the microphone. So we also want to make sure the audio quality is really high for this meeting since we are recording it. We also advise everyone to turn their videos off. It's wonderful to see everyone, but it also, by reducing videos, it improves the bandwidth and the quality of the meeting recording. And then please use the chat box to ask any questions. Gina, do you want to ping the chat box again one more time just so that people can see that pop up? We'll have time to go over your questions at the end of the call, and I will read out the questions. If you're joining by phone, I haven't seen anyone join by phone yet, but please unmute yourself by hitting *67 and just go ahead and jump in when we open the floor for questions. And I'll moderate that a little bit too with Gina. So that's really all I had. So thanks, Gina.
Yeah, I'll just add one more thing here, because I was doing this in a meeting and nobody could read it. Once you type in your question or whatever you have in the chat, you have to hit the enter or return key for it to appear, because I kept arguing that people couldn't see my stuff because they were blind, but it's because you need to hit the return button. So thank you so much. I think we're going to get going with the content of this call and training, and we again are just as pleased as we could be to welcome a team of that have been working together to plan for you. And I think, Melissa, if you can pull up the slides. We're going to start with communication with older adults, and particularly best practices communicating with individuals with cognitive impairment and other potentially stressed caregivers. So Ellie McConnell, Liliana Marin, Michael Peterson, and Bobby Matra. Y'all take it away for us. Thanks.
Okay, Gina, thank you. So I'm the front woman for this band of people who do the kind of work that we're here to help with, which is telephone reassurance. And I want to acknowledge the Durham Center for Senior Life, the Duke Dementia Family Support Program, Duke Family Medicine and Community Health, Dementia Inclusive Durham, the Partnership for Seniors, and the School of Nursing. If I could have the next slide, please. We've all partnered together to put together this presentation. Our goal is to try and help those of you who may be less familiar with telephone reassurance to recognize best practices in providing telephone reassurance to older adults, and hopefully to anticipate some challenges that you may encounter as you begin to engage with seniors over the telephone. To do that, we're going to have the experts, people like Michael Patterson, like Liliana Marin, and Bobby Matcher, provide some tips about communication. We're also going to make reference to one of the handouts that you should have received through the email, the COVID-19 check-in call for Durham seniors script. And then we're going to do a little role play to let you see how this might unfold in action, give you a chance to participate with that chat box in a way that we'll structure in just a moment, and then end with a question and answer period. So if we could have the next slide, please. Liliana, if you're on the line, if you could take it away and offer some of your tips from your work with student volunteers in interacting with older adults.
Thanks, Sally. Hi, everyone. My name is Liliana Marin. I'm the program manager for the Duke Division of Community Health Benefits Enrollment Center. I appreciate your participation in this training, and I hope this information comes in handy when you're reaching out to your seniors. I listed my top 10 tips. I know there's so much more that I would love to share with you, and I have put together a document that I'm sure Gina and the rest of the team will share with you at the end of this phone call, or they probably already email it to you. My number one advice is to see the phone call as an opportunity for you to have a pleasant conversation, not only for your client, but for yourself as well. We want you to be able to have a friendly conversation. That's exactly what we all need during this time that we are socially isolated from each other. Please make sure to introduce yourself, making it very clear where you're calling from and the purpose of your call. That is very important. You might need to repeat your statement a couple of times if the client has hearing issues or is wearing a hearing aid. Sometimes the TV or the radio could be playing very loud in the background. Just politely ask them to lower the volume for the conversation to be clear and successful. Um, Take your time whenever you're giving them instructions or phone numbers. It's important for them to capture that information correctly. Please use Mr., Mrs., Miss. We want to be respectful and professional throughout the whole conversation. If you promise to call your client, please do so. This will help you maintain this type of like trust in order for you to be able to be successful in future phone calls. If they ask you for a resource and you don't have the answer in front of you, or you just don't know the answer to it altogether, don't be afraid to be honest to them. Just let them know that you're going to go ahead and do some research and that you're going to call them back with that information. I highly recommend for you to use the resource link that we're going to be sharing with you during this training. But if you decide to Google something, please verify the information and the organization. We need to make sure that those resources truly exist. And if they're actually assisting during this time, I want you to be aware that seniors are a big target for scams, and we want to protect them instead of putting them at risk. And if you're interested to learn more about other tips or suggestions that you want to be aware of before you make your first phone call, please take the time to review the material that we put together for this training because we're only covering a small handful of important tips. Thank you.
Liana, thank you so much. So next, and if you'll advance the slide for us, I want to turn things over to Michael Patterson, who is a Senior Options Counselor at the Durham Center for Senior Life. And he supervises older adult volunteers who are making telephone reassurance calls. Michael.
Yes, thank you very much, Ellie. Good afternoon, everyone. I'm going to go over some keys to effective communication as well as some barriers. I'll be piggybacking off a lot of what Liliana has just spoken on. The first one is preparation. You want to be prepared before you make your call. You want to have your script if you're provided with one, resources, as well as the purpose of your call. Don't be afraid to practice beforehand, okay? Once you make that call, you want to speak clearly and effectively. Talking straightforward, enunciating your words, being clear and concise will help with, especially speaking with seniors so they can understand and follow the conversation. Excuse me. Number 3 is be an active listener, okay? When you are talking to individuals, you want to make sure that you are listening twice as much as you are speaking. You want to be alert. You want to be aware of what they're saying so that you can truly hear what their needs may be. You also want to clarify and summarize, which will help you be an active listener. So as you're listening to individuals answer your questions or just provide you information, you can absolutely clarify by summarizing what they've said to you back to them, just to ensure that you have the correct information, and also lets that individual know that you're listening to them. And also during that time, you want to be empathetic. You want to make sure that if an individual is in a situation that is a crisis situation, that you're understanding that situation. Being empathetic can be very broad, but you just want to make sure that you are being respectful and understanding of this individual. Some of the barriers to effective communication is not being prepared, just picking up the phone and calling, and not having your information and materials ready to answer and to help assist with that phone call. Also not paying attention. I know we may be working with some younger folks, so we're going to ask them to make sure they're paying attention, not multitasking by also being on their phone or doing other things. Another thing is don't use a lot of technical language. I know in our world, we have a lot of acronyms for services and programs, and it sounds like alphabet soup to seniors. So you want to try to lessen the technical language. You also want to avoid giving solutions or unwanted advice. Even though we are calling to provide services to these individuals, you don't want to get into a situation where you are giving medical advice or you're giving advice that they had not requested, which leads to the last one is avoiding the rabbit hole. Sometimes if you're giving advice or solutions, you could fall into that rabbit hole where an individual's asking you for information and assistance about something that you may not be 100% familiar with or comfortable with. And you don't want to start going down that rabbit hole and possibly giving wrong information or the wrong facts. So those are some of the keys to effective communication and some of the barriers. Thank you.
Michael, thank you so much. So I'm going to turn things over to Bobby Matcher of the Duke Dementia Family Support Program. Bobby and others have pointed out to us that older adults oftentimes serve in many different roles, and one of the more challenging roles can be being a caregiver. So we thought it would be really helpful to hear from people who've been answering the phone for 4 decades, talk with us a little bit about what to pay attention to. So Bobby.
Thanks, Ellie. First, I want to say that the tips for communication that Liliana and Michael just talked about apply to caregivers and people living with dementia. Those were all really good points. So I'll take a couple of minutes to talk about the reasons why the pandemic is especially challenging for this population. Much of what I'm going to say is based on what caregivers have discussed in support groups and over the phone during the past few weeks. For caregivers, many family caregivers already felt very isolated before COVID-19. It can be really lonely living with someone with dementia, especially when they've progressed past the early stage. So the loneliness and isolation is much worse now that we're all living with social distancing. And some caregivers were getting breaks before the pandemic, but now adult day programs are closed, and family members, friends, and often paid caregivers are less available to give family caregivers a break. So that means additional responsibilities for dementia family caregivers. They're doing extra cleaning. Some are now doing and complaining about doing a lot more cooking since their loved ones no longer getting meals at the adult day center. And family caregivers are having to provide constant companionship and frequent activities for their loved one. And caregivers are even having to assume more responsibilities for personal care, things like bathing, that they may have had some help with prior to the pandemic. And people living with dementia probably need extra reminders about basic steps to prevent illness, like hand washing and social distancing. And these extra responsibilities and extra vigilance can be really exhausting. We're hearing from caregivers who are anxious. They're anxious about what happens to their loved one if they get sick, the fact that their family member can't describe their symptoms if they're sick. I hear from caregivers who are distraught that they can't visit their loved ones in assisted living facilities or in memory care. And caregivers are wondering if their family members' increased isolation, increased anxiety, agitation, and clinginess is ever going to go away. As for those living with dementia, many know that something's wrong, but they don't really understand the pandemic. And the decreased opportunities for exercise and social engagement may worsen their anxiety and agitation. Routine is something that's really, really important for people living with dementia, and they're likely to be very sensitive to changes in the routine that we're seeing now. And then there's the decreased social stimulation. Keeping active and socially engaged is really hard for people living with dementia, and it's especially so during COVID. And then finally, caregivers are reporting that they're seeing their loved ones slipping during this time of decreased social stimulation. So these are all reasons why families living with dementia are especially going to be appreciative of your volunteers calling. Thank you very much for volunteering.
Thank you, Bobby. So we want to turn now to a little role play, and what we're hoping to demonstrate is how this unfolds in sort of real life using something known as a freeze frame exercise. So if you could turn to the next slide, Melissa. What Michael Patterson and I are going to be a senior, and he's going to be the telephone caller. And we'd like for you to just listen to our dialogue for a moment. And as you listen, we'd like for you to use the chat box to let us know what challenges you see in this role play and what recommendations you would have for us to manage those challenges. So I'm going to turn off my video and just go audio only here. So Michael, I hope you're ready.
Yes.
Ring, 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 ring. Hello?
Good afternoon. I am Michael Patterson. I am part of the Durham Partnership for Seniors COVID Response Team, which is a public-private partnership to support older adults living alone. Because of the coronavirus, we are all being asked to stay at home except for emergencies or to get to food and medicine or a doctor's appointment, at least through April and possibly longer. We're calling to see how you're managing with these restrictions.
Oh, well, hello. Well, it's very nice of you to call. I didn't quite catch your name. Could you just wait for a moment while I get a pencil and paper to take a few notes here? Now, tell me again where you're calling from. I don't recognize your number. And could you please spell your name?
Yes, my name is Michael, Michael, and I am calling from the Durham Partnership for Seniors COVID Response Team.
Well, thank you, Michael. Now, can you please tell me again, why is it that you're calling me? You're not asking for money, are you?
No, I'm not, ma'am. We're calling seniors in Durham to see how you're managing with restrictions from the COVID-19, such as staying at home. How are you doing?
Well, I'm really quite upset about all this. I mean, I don't know how I'm supposed to get my groceries when we're being told to stay inside. I don't have the money to pay someone to go to the grocery store for me. And my family are all out of state. And oh, by the way, I've got a husband to look after, and I couldn't leave him alone even if I were allowed to go outside. So what is it that I'm supposed to be doing? So here's where we're going to freeze the frame. And we're going to give you a grand total of 30 seconds to talk about what you see as the challenges here and what it is that you'd recommend we do about them. And I'm going to hope that I can look at this chat box. And Jamie Lampkin is saying that was a ton of information rolling off his tongue. Slow down a little bit. And I think that's a terrific idea. Maggie is saying a little bit too much information when the call was answered. Maybe need to pause and let her speak. And then Karen A. Smith is saying, well, it seems like he jumped right into the reason for the call. Maybe it would have been helpful for her to connect with him a little bit as a person before he rolls into the conversation. And I see a lot of other, I think, really helpful ideas about, you know, affirming my stress and being cautious about advice. Liliana or Bobby, any thoughts about Michael's approach and what you thought was strong and maybe how typical this might be? And Michael, we'd be interested in hearing you too. We shoved you into some do's and don'ts.
Yes.
Hi, everyone. This is Liliana. I thought that was wonderful, first of all. I would like to say, I think there was a comment that mentioned, well, he started telling them why he was calling right away. I think that's actually important because you'll be shocked how many times people will hang up the phone if you don't get right to the point. So first of all, you want to let them know who you are and the reason why you're calling, because you want them to know the purpose of why you're interrupting their day. So I just wanted to address that one comment before we continue to move forward.
Michael, any thoughts from you or from Bobby?
I thought Michael was warm. He talked slowly. He was patient. And I thought that, Ellie, you played a very realistic person we might be talking to? Apprehensive?
Well, thank you. We'll do the Oscars later, but I think we are close to out of time. We're a little over time, I think. So, Michael, any thoughts before we sort of ask Melissa to turn to the next slide?
Yes, and thank you all for your responses. Exactly how I was reading the script that we have here is how you want it to sound. You want it to sound conversational, but like Liliana said, even though it's a mouthful to start off the conversation, it is important that you understand that you are getting to the point of why you are calling. If you're not straightforward with why you're calling, it could turn into a much longer conversation than you anticipate. If we have a listing of 100 seniors and we have volunteers who are trying to get in touch with everyone and ensure that everyone has the services that's necessary, it's going to be important to make sure that you're not rushing the phone calls, but yet you are communicating effectively and clearly so that the senior knows why you're calling, what you're calling for, and hopefully you can get through the conversation at a good pace. Being patient, talking in a friendly tone is going to be important. And again, it's just going to be, the more you practice it, the better you'll be at it. It's really going to be key.
Well, Michael, thank you. I couldn't agree with your comments more. And I think in the interest of time, Gina and Eve will just dispense with the rest of our slides. People have them available. And hopefully during the Q&A, we might be able to address some of the really good ideas that have been put forward here. So thank you so much.
Thank you guys so much. And we will have a time for question and answers later. So if you have questions about this, you can put them in the chat, or we have an opportunity later. Next, we have Kim Nichols, who's helping with the Stephen Ministry, and she's going to talk to us a little bit about how you really listen to people, and particularly people that may have spiritual or mental health needs during this period. So Kim, thanks for joining us.
Thank you so much for the introduction. Yes, I was really impressed by the previous presentation, and especially a lot of the things that Michael touched on with listening. Those were some of the things that I would have definitely added to his presentation. But what was just said is the importance of how listening takes patience. That is so very important. A lot of times when we talk to people, we want to solve their problems or come up with a cure. And a lot of times when we lack patience, we try to hurry the person through the process. And a lot of times it just takes a long time to listen to somebody and understand and just be there for them. The physical setting is very, very important when you're talking to people that need care, not only spiritual care, but any kind of care. Asking them about distractions. Is it a good time to talk? Is anybody there with you? Those are all helpful things. And also paying attention to your own distractions. Is your television down? Are there people there with you? All of that's very, very important. And also planning ahead for listening. That is so very important. Knowing your goal and what you're going to talk about with the person, and just being there to hear their concerns. But taking care of your emotional health is so very important, and it covers a lot of things. And the thing is a lot of times people feel that when you are meeting a person that may have spiritual needs, that they're different from anybody else, and actually they're not. But a lot of times when you're talking with elderly people, they will let you know if they're concerned about spiritual issues. They may talk about prayer, or wondering if God understands them or hears them. And you just have to be very, very patient and listen to what the person is saying. But a lot of times people, when they have spiritual concerns, sometimes it can lead to other things like depression, worrying about their own health and the health of a loved one. You also might notice from talking to them that they talk about they're not sleeping or they're not eating. Their health problems are getting worse. All of those things can be signals that they may need more help than a volunteer can provide. And sometimes they'll ask to talk about spiritual things. That's where Stephen Ministry can be very, very helpful. Stephen Ministers don't force people to talk about spiritual things, but they welcome it if they want to talk about those things. And all of those things can be very, very helpful. One thing I do want to add is when it comes to listening, I always remember that the word listen and the word silent, they have the same letters in it. And so a lot of times we feel that we have to do something or fix something, but all we really have to do is be silent and listen to the other person. And if they need more help than we can provide, all of you got the handout. Alliance offers 24-hour access and information, an information center, a number that you can call. And as far as Stephen Ministry, what we do is we match people up with somebody providing that asks for care, and we'll match them up. They spend an hour a week with that person just listening, and they're trained to notice suicidal tendencies or if the person needs more than they can provide. But the handout is a really good handout to have for all volunteers. So thank you.
Thank you so much. We have, you're going to hear about in just a minute. So you're hearing about telephone reassurance, and we thank Kim and Ellie, Michael, and Liliana for their presentations. You're going to hear now about some practical help and how you connect people with some of these services we're talking about, as well as how people can volunteer, as well as how the volunteers can find resources that exist in Durham. So I'm thrilled to welcome Melissa Black, Liliana Marin again, and Janet Bedker, and Peggy Kernoodle for the next presentation. Thank you. Kernoodle, sorry. I'm not sure. I think Melissa starts us off.
Okay, yeah, so hi. So I am just going to provide a quick update. So I know that everything has kind of changed very rapidly and very quickly. And I know that a lot of agencies have had to kind of pivot how they're providing services, or now they're doing a lot of more in-reach to their clients than they have before, and since they can't come to them. And so there's been a lot of questions and discussions of, obviously people are sheltering in place, and so they're staying home, and so they have more opportunities to be able to volunteer from their home, whether it's telephone reassurance or helping Meals on Wheels or the Durham Center for Senior Life deliver food. And so it's kind of that key connection between those who want to be able to help volunteer with those agencies that need additional help. So I just wanted to share that we are currently working on a process to streamline that connection. I'm working with Kim Shaw with the Volunteer Center of the Triangle and Hands-On Triangle to see if there's a better way that we can streamline that. So obviously, when talking about next steps, we'll be sharing how, we'll be facilitating that conversation and then providing those connections once we've figured them out.
Thank you. We know that the Triangle Nonprofit and Volunteer Leadership Center has a website, as well as the School of Conversion. So Jonathan Wilson Hartgrove and the people working in Walltown also have a connection that was in one of your handouts. And I think I'm going to hand it over to Liliana, Janet, and Peggy now for the next part of the presentation. Liliana, maybe you're up next with the Benefits Enrollment Center confidentiality.
Hi, I was waiting for somebody to give me like the title of what was coming next. Thank you so much, Gina. And I think I'm gonna cover a couple of topics because I see that they're like right next to each other, so might as well I just go ahead and complete my section. So I was asked to share an example of how we enroll our students in the BEC call center, what kind of forms we ask them to complete, what kind of trainings they have to complete in order for them to start participating in this, in that particular initiative. So I just want to make something very clear that the process that we use under the Benefits Enrollment Center is going to be probably very different to other organizations. But what we want to do is we want to let you know that there is a chance that if you're going to be volunteering to do this type of work, there is going to be a process that you need to complete in order for you to start doing this type of work. Under the Benefits Enrollment Center, we complete a confidentiality agreement in order for us to protect the information of our patients. We also ask them to sign a photo consent form in order for us to use the pictures that we take, the videos that we take, in order for us to advertise the work that we do. And then we ask them to complete a community training module. And what that module does is it gives them a full overview of the do's and don'ts whenever you're doing community work. After they complete those 3 requirements, we schedule a time for us to have a one-on-one training in order for them to understand the process on how to receive referrals and how to help seniors connect to benefits and resources. Now, I'm going to mention this again. The reason why we're sharing this information with you is because we want you to be aware that there's going to be a process in order for you to start volunteering, and the chances of you having to complete some of these forms are pretty high due to the nature of this type of initiative that we're trying to do. There are going to be occasions where you're going to, be on a phone with a client, and they might disclose some medical information, some financial information, and at that point, a confidentiality agreement might be necessary. So just to keep that in mind, and that's going to take me to my second topic, which is making calls and the use of a personal phone. For those volunteers who are going to be using their personal phone to make these phone calls, we put together a document where you have access to see what systems are available for you to protect your phone number if that's something that you want to keep private. We have some options as simple as dialing *67 to block your number, or some other resources that might need you to check with the organization where you plan to volunteer to make sure that they provide access to those options, because there is a cost to those services. And finally, we have another option, which is, you block your number, you send the client a text message letting them know at what time you're planning to call them. And what that's going to do is going to give your client an idea on when they should be expecting your phone call. Now, for this particular system, I suggest that you check with your client before you decide to use before you decide to send them a text message. You want to make sure that they know how to text and that they have access to text messages with their phone service. Some of them might have a flip phone, and we remember the good old days of texting with a flip phone. It was extremely complicated. So that's something that we want to make sure that we check with them before we decide to use this particular option. And last but not least, I want to take the opportunity to review a script that was created by everyone in this that has put together this training. And the reason why we decided to share with you a script is because we want to help you have an idea on how to manage the conversation in a very natural, organic, very friendly manner. We want to make it feel like a conversation and not like they're completing a survey. And that's the reason why we decided to put together this manual. The purpose of it is to get a better understanding on how social distancing is impacting older adults in Durham. But before you start making these phone calls, it's important for you and your team or the organization that you're going to be working for to have a place where to keep all these notes, all this information. We have learned with the experience that we have attained in the past few weeks making these phone calls that is crucial for the team to have details about the conversation in order for the next phone call to go better or go easier. So that's something to keep in mind. I'm gonna go ahead and go straight to the script now. And like I said, this is a script for you to use during the initial COVID-19 check-in call. You can continue to use it in the future. You might have to modify it a little bit, but we created this for you to have a structure for your first call. The purpose, once again, understanding of how social distancing is impacting older adults. We want to find out if they have enough food, enough medicine, if they have access to medical care. We want to know if they have some type of support system in their community. This could be friends, this could be family members, this could be neighbors, and we also want to use this opportunity for us to offer helpful safety reminders about COVID-19. Now, let me make this very clear. We are going to be sharing helpful safety reminders about COVID-19, not medical advice. So that's something I wanted to make very clear right here. And finally, we want to connect people to other resources. During these conversations, there are going to be times where your client might ask for resources regarding nutrition, and it will be great for you to have that information nearby during your phone call. Now, if you don't have the answer to those questions, like I said earlier, it's better for you to be honest and say, I don't have that information in front of me, but let me go ahead and look for it, and I'll share it with you as soon as I locate that information. Another thing that we like to do is to record the name of the caller, the date, and the time. That will be very helpful for you and your team to know who was the last person that spoke to that client and when was the last time you guys give them a call. So that will be something that will be beneficial for you and the rest of the callers, just for you to have as a reference. And then we start the conversation with a warm greeting, making sure that they know your name, making sure that they know where you're calling from and the purpose of your phone call. That should be done as soon as they answer the phone, in order for them to know the reason why you're calling them. And like I said earlier, that reason is to find out how they're managing things during this difficult times. And that's going to open up a conversation. Now, during this conversation, clients might disclose information about how needing access to food, medication, needing access to healthcare. So it's very important to you be listening in this initial conversation and making notes about what they're saying, because you don't want to ask those same questions as you continue to do the script. We want to remind them that we're listening, and that's the reason why we're calling, right? This script has 3 sections. The first one is about food. And what the information that we want to collect from here is going to be, how much food do you have? Do you have enough food for a week, for 2 weeks? We want to know if they have other resources available, like Meals on Wheels, if they're receiving the senior box. And if they're not receiving those resources, that will be a time when the client might ask to be enrolled on those resources. So having that information will be beneficial. And the reason why we're asking is because we also want to understand how much support they're receiving from the community, and it will help you calculate how often they're gonna need your assistance. As we continue with the script, this will be a great time for you to ask them if they have anyone that could help them, do the grocery shopping, maybe order some items online. Do they have a family member that check on them? It will be great for us to have an idea if there is someone that is supporting them throughout these difficult times. And in this section, now that you're having a conversation with the individual, this will be a great time for you to go over that information that we spoke about before, keeping their distance, reminding them it's important for you to wash your hands, keeping it very general. This is information that is available to everyone. We probably hear it day and night right now. We're not talking about any type of medical stuff. As soon as you hear them saying, hey, I'm feeling this, or I have this symptom, right away, you have to let them know that it's important for them to contact their clinic, their caseworker, their social worker. This is not something that we're here to do, but we're happy to let them know what will be the best way for them to receive that assistance. There is going to be probably some conversation about that, and you're going to be able to notice how much support they have or how much knowledge they have in order for them to navigate their healthcare system. So having those answers will be important, and I believe we're going to cover that down the road in this training. We mentioned this, the following questions. We want to know if they have access to a computer in case they need to order groceries. And if they don't have access to a computer, do they have someone that could do that for them? Are they aware of the stores that are currently delivering groceries for free? So that's information that you're providing them with, which if they have someone that is helping them today, and if God forbid something happens down the road and that person is no longer available to assist, they have in the back of their mind, there is a plan B, there is another resource that I could use. So that could prevent, it could prevent them from having some type of anxiety or stress, knowing that there is some other options. And if they don't have anyone that could help them with this process, I think it will be important for us to ask them, would you be comfortable having someone helping you with that process? And that's when you will provide them with that information in order for them to have access to that resource. The medicine section is, we have it here because we want to make sure that they have access to their medication, whether it's a 30-day supply or a 90-day supply. We want them to know that the 90-day supply is an option. Sometimes seniors are a bit concerned of asking for the 90-day supply because they will have to pay, the 3-month co-payment. But let them know that pharmacies are, they have resources that they could take advantage of, and they can always call their local pharmacy, like senior pharmacist. We have people that will be able to guide them in order for them to know what's available for them. And then finally, we want to find out if this process was helpful to them. We want to know if this is something that they want to continue to receive. Do they want to continue to hear from one of our volunteers? Did they found this information helpful? And if that's the case, ask them, would you prefer for us to, how often do you want us to call you? Is it like once per week? Is it twice per week? And then we'll be able to get a feeling of how often they'll feel that it's important for us to, just pick up the phone and check on them. Wrap up the conversation, asking them, do you have any questions for me? Is there anything else I can help you with? At this point, it's going to be, you're going to get the feeling of how the person felt about the whole conversation. And if they found the conversation helpful, this will be a great point for you to reassure them that you understand that these times are very difficult, but you hope that this initiative could make things a bit better. And the fact that, they will know that, they're not completely alone, and then you'll be calling them within the next few weeks. Thank you.
Thank you so much, Liliana. Peggy, I don't know if you wanted to say anything about food, and then we'll hand it over to Janet, who'll talk to us about the shared database.
Okay. Yeah, I was going to actually address 211. Maybe I should do that first.
That's fine. Thanks.
I know many of us have clients that we're certain that they're not very comfortable with computers, even if they have one. And so we felt like it was very important that if they are hesitant, rather than worry about phishing or things they've been warned about, that they have a method to contact and find out information and contacts in the community via phone. So of course 211 would be a logical thing to try. So as a volunteer, if you haven't tried 211, just pick up the phone and give it a try. It's very easy, and I think you can explain it to the senior and then let them know that they can try it. If it doesn't work, hang it up and try again. For example, 211 gives the option of English or Spanish. They choose an option, and I chose English 2-1, and then I have the option to choose coronavirus information, number 1. If you hit the wrong number, start again. From there, you can choose from identifying symptoms of corona, food resources such as pantries, and then other resources in the community. If you do go for food pantry, it will ask you for your zip code, your county, your town, and your phone number. So hopefully that won't scare them, because the reason is because, and they do share, that United Way records information as far as the phone numbers, just because they have to keep a record of what they do in the community. They're not going to be calling back. So this is a wonderful resource. So hopefully as a volunteer, you can familiarize yourself with that and encourage them to give it a call. As far as food resources, of course, I'm guessing Marissa with the health department will cover some of that, but I'm with North Carolina State Cooperative Extension, and we have resources and food portal resources that you're welcome to call. If you want to give me a call, we can talk further on that. My number would be 560-0523. It's 919-560-0523. And my cell is at the end of that message, and it is fine. I've had lots of clients to call me with information about food safety, or, washing bags that they've brought groceries in, etc. So I'm glad to handle that. But yeah, so encourage them to, even if they're not computer savvy, to give 211 a try.
Thank you so much, Peggy. And now we're going to hand it over to Janet, who's been working for a while with Lincoln Community Health Center to try to help steer people to resources. And she's done a great job with her team to consolidate some resources. So Janet.
Thank you so much. Hi, everybody. Really great to see such a wonderful turnout today. I wanted to recognize that we are really crowdsourcing. It's such an interesting time as it is in North Carolina with things changing across the state. I'm really glad Peggy described 211, and some of you may be aware that there was also a state database that was going to come online or is rolling out over the state called NC Care 360 that also has many of these resources, but we don't yet have that fully active and operational yet in Durham. So we had, in lieu of NC Care 360 to support patient care at Lincoln, we also had a community-based resource directory to be able to support patients' social, medical, and basic needs, and realize that in the space of COVID, there are so many people that want to help others in bringing lists of resources together. And so as we realized that we had a list and others had a list, we partnered with the Community Empowerment Fund and have slowly started to reach out to others to bring those databases together in one place. What you see on your screen, and what I'll do is I'll actually also, if some of you are on your phones, it might be hard to see on your screen, I'll put the link here as well in the chat if you wanted to click on it and follow on your phone. Is a directory that's available in a couple of different places, and we're trying to communicate it broadly. Well, as I mentioned, we're trying to crowdsource information and bring it into one place, and also to support 211 so that they can use this as well. So you can use it as a volunteer, people can use it directly, services can use them as they're supporting other people. The way that this resource directory was set up, and as I mentioned, it's evolving literally every day, is that we have a team of students at Duke working with volunteers and staff at Community Empowerment Fund to continue to pool information under the headings you see here, predominantly focused on mutual aid, medical care. We're working towards hopefully the prescription medicines, behavioral health, food, housing, communication. You see the list there. These can be linked to further information, and I'm wondering if whoever's driving the website, maybe Melissa, if you want to click on behavioral health maybe. So you can either click on the tab on the bottom or within the page itself, and what you'll see there are resources that we've either learned about, that we had in other directories, or that we've reached out to, and they're organized by who they're for, who they're provided by. There's a description, a link, a telephone number, going down everything from Quitline, Healing Care, Durham Center for Senior Life, Alliance Health, and others. What we wanted to do is be able to have a place where people could go to have information that we are updating every single day. So our teams and our students, our volunteers are calling to keep this information up to date, and which is critical right now as different services, clinics, every location is needing to consider their own safety in the face of COVID, the safety of their staff, the health of, and well-being of their families. So this directory may not be entirely complete, but what we've done is at the top of the page, you'll see a green button. And if you notice that something is missing and you think it should be added, please go ahead and click the comment box. We have our teams reviewing this every single day in teams by category. They will reach out to the service, be sure that the information is complete, and update it within 48 hours. So if we go back, if you don't mind, Melissa, if you're driving, or Eve, back to, yeah, the main page, fantastic. You'll see that the link at the top is the one that we dropped in for you, the tiny URL. You'll also see that we're working with a team of people, Angel and others, to have this full directory translated into Spanish. And so that's available for you. So everything you see here is about 2/3 of the way through being translated into Spanish. If any of you need help with this or the information that's on it, CEF does have staff. They are managing a helpline that is available Monday to Friday during general day hours, 9:30 to 5:30. You can also call that and say, you know what, I'm trying to find out more information about this, and we can help they can help navigate that with you. So this is one additional source for you. And again, we will continue to update this, manage it, and have it evolve to best support the needs in Durham County.
Thank you so much, Janet. So I'm just going to add one other resource that many of us through the years have known about, Network of Care in Durham. So that's another resource database that's out there. They also have some COVID information. Excuse me. But many of us, and like senior pharmacists, is going to feed the database that Janet just was sharing. And the hope is that eventually it'll all find its way to NC Care 360 once that gets up and running. So it truly will all be in one place and linked to the 211 phone system. So thank you so much to you and your team for all y'all are doing, and CEF for keeping that up and going. Now we're going to shift a little bit and talk a little bit about healthcare. And we've asked Marissa Portaboy and maybe her dog, I don't know, and Dr. Mitch Heflin to
that is my dog.
Okay, to talk about their animals and their health care. Okay, one of you take it away. Thanks so much.
Hi all, this is Mitch Heflin. And Marissa and I want to talk a little bit about a topic in which, of course, we've all become experts, whether we wanted to or not, and that's COVID-19 infection. And we anticipate that you may well be asked in making these calls about COVID-19 and the infection. So wanted to provide you some of the basic information and resources about that. Marissa, do you want to say anything by way of introduction?
Sure. I'm Marissa Mortaboy. I'm the Partnership for Healthy Durham coordinator, and I also work for the Durham County Department of Public Health, and I've been helping with some of the communications from the health department to get information out to the public about COVID-19.
Great. So I think an overarching principle here is we can convey the seriousness of this infection, but also in a way that's reassuring and empowering in terms of knowledge about the illness and things that can be done. I think this is, of course, an unprecedented time and a remarkable infection that has affected the entire world and required us to do things that we would have never imagined that we would have to do in our society. I think it's also important to acknowledge that older adults in particular are not just at increased risk of the infection, but at increased risk of the side effects of the isolation that's being requested of them. And so that's the double emphasis in the conversation and makes these reassurance calls all the more important. So I think in thinking about language you might use, I think it is important to acknowledge when they ask about the infection or express fear, to acknowledge that this is a frightening time, but that there are clearly steps that can be taken that will reduce your risk and the risk of your family of contracting the infection. And that becomes all the more important to make sure that you're connected with medical care and resources. You all know by now that the basics of the infection, that it's spread through droplets of secretions and by other bodily fluids, and that the vast majority have a mild infection, up to 81%. But of course, the folks at highest risk of developing severe infection, complications, and even death are older adults, those over 65, and people with chronic illness, lung disease, heart disease, kidney disease, diabetes. I think it's also important to acknowledge in the press today the fact that African Americans are at a disproportionate risk of contracting infection and having complications and death. Those reports indicate that, in fact, while this may be in part related to higher rates of chronic illness, we know that there are social and systemic factors that are clearly part of this, and that this process has amplified and makes this process of community engagement and reassurance all the more important. Also, we know, again, that infection and spread can be minimized and controlled by a few measures that Marissa will talk about in a second. I think it is important to be ready and prepared to empower people with understanding of the signs and symptoms. And these are conveyed very clearly in this graphic from the health department that summarizes both the symptoms and things that folks can do, and specifically early symptoms of fever, fatigue, cough, and shortness of breath. But symptoms may also include headache, stomach upset, and diarrhea. And letting folks know if they develop these symptoms, even if mild, it'll be important to call their doctor's office to get advice regarding care and testing. And there are some system-specific numbers, in addition to the 211 number, the COVID, there's the North Carolina COVID hotline, and I'll forward this number in the chat, 866-462-3821. And then the Duke Health COVID-19 hotline, which is 919-385-0429 for people that think they have been exposed and or have developed symptoms as well. And so I think for those who have symptoms or have potential close contacts, it's important to get that advice by contacting one of those two numbers. I'll let now Marissa take on describing providing you with language with describing some of the measures that can be taken to control spread of infection.
Thanks, Mitch. And yes, so he's talked about some of the messages that we're really emphasizing to the public about the symptoms, ways to protect yourself. It includes washing your hands for at least 20 seconds with soap and water. And if soap and water are not available, then using hand sanitizer with at least 60% alcohol, and avoiding touching your face with your unwashed hands, which can be hard to do, but I think we're all getting better at it. Staying away from others who are sick. And if person feels symptoms themselves, whether it's COVID-19 or not, that they stay home. And Mitch already mentioned, but calling your medical provider. We don't want people to show up either at the emergency room or their medical provider, but to call first to be able to give some advance notice. And so if you go to the next slide, Melissa. Thank you. And so we've also been talking about social distancing. So a lot of the people you speak to may already be doing this. And so this is one of the best tools that we have against COVID, asking people to stay home. But if they have to go out for essential trips, and this is for food, for medicine, for healthcare, or to help take care of someone else who is not feeling well, then they practice social distancing. And so staying at least 6 feet away from others. So I think this message is getting out more, but it's something that we keep hitting on. And we know with COVID, since it's a novel virus, that we're learning all the time. And so one thing, new guidance has come out from the CDC this week about covering your face. Surgical and 95 masks to be for healthcare providers, but a cloth covering. And there's actually on health department website and social media how to actually make masks as well. And so if you can go to the next slide, Melissa. And so this is something we put together. So Mitch mentioned some of this, and it's already been mentioned. So 211 in the state hotline, you can see the 888 number, it's available 24/7. There's also, in addition to the Duke University hotline, there's a Durham County hotline, which is 919-635-8150, which is available during business hours, 7 days a week. And there's a new number, COVID-19 Triage Plus, which people can call to ask questions about symptoms and also about chronic conditions that they already have and assist us with managing that. And you could also text COVID and C to the number on the screen for text updates, and that's from the state as well. And so go to the next slide, Melissa, please. And so I think everyone can probably hear my cat, but another question that we get is where to find accurate information. And so we tell people trusted and reliable resources. And so, so those are either North Carolina Department of Health and Human Services website at ncdhhs.gov, cdc.gov, or DECO Public Health for the local health department, and also on social media because this is such fast changing information. So going to the social media websites, and I know the people you may not talk to may not use the internet, but these are great resources to find the latest guidance and information as well. And so if you can go to the next slide, Melissa, please. And so the Durham County Department of Public Health website is updated regularly, daily, multiple times a day as well. And so decopublichealth.org is the website. And so that's the, this is what it looks like, coronavirus disease 2019. And so if you click on that, it'll take you to the picture in front, which is our COVID-19 page. And so there's information which is updated daily on case counts and a number of people who have been confirmed positive. We have had one death so far, and that's updated. It's around 6 p.m. each day. And also if you look to the side, there's also frequently asked questions and information about the hours for the health department. And we have graphics. So some of the things I showed you are on that graphics page. And we also have COVID-19 email lists. And so there are different lists for the general public, for businesses and faith communities, also in Spanish as well. And so if you go to that page, you could sign up to get updates daily about COVID-19. So that's another good source of information too. And so if you go to the next slide, please, Melissa. And these are our modified health department hours. If you speak with anyone who needs services, we have limited services, and our hours have moved to 9 a.m. to 1 p.m., which is similar hours to Department of Social Services. And so that's another thing to get the word out about, is that we are still offering services, but they are limited and limited hours. And so that's the information I had to share. So as you're making the calls, you have some additional resources.
Great. Thanks, Marissa. I think probably just wanted to add an additional point about folks may be getting the message to stay at home, but staying at home does not mean neglect your health. And that folks, if they're having health problems or symptoms or questions, still need to be encouraged to contact their primary care physician. Specifically, a prompt to have them call ahead, because many offices are trying to minimize exposure, so trying to handle things over the phone or arranging for telephone or telehealth, televideo visits, which actually Medicare is now reimbursing for more liberally than they had before. Also, some confirmation that they have access to medications, and particularly in larger allotments under special exceptions through Medicare Part D. Those are important items and issues as well. So a take-home message is that Lincoln, Duke, UNC are open for business, and people should be encouraged to contact folks. The folks at Lincoln emphasized as well, with rising rates of unemployment and loss of health insurance on the horizon, that they are also still taking new patients, and that people should see that as an important option as well.
Thank you, Marissa and Mitch. We wanted to have, I think that if y'all are done with your presentation, I think we really wanted to spend some time with question and answers, and there have been a lot that have shown up in the chat, but we feel like there are other ones that are there. Eve, do you want to tell us how we want to handle this question and answer now?
I was just going to first ask if anyone on the phone has a question that was only on the phone and wasn't able to use the chat. If you can unmute yourself by pressing *67, you can ask your question now. All right. So, and again, if you want to jump in, if I didn't give you enough time, just wait for a little break, and we'll have another opportunity for anyone on the phone who has a question. So some of the questions that I'm seeing right now. So I was looking at some of these have been responded to, but I'll just repeat them so that everybody can hear them. The one was, we understand, oh, sorry, that's Gina, I'm sorry. I need clarity on who I should call if I've been exposed or if I have symptoms. And I think Dr. Heflin just addressed that, but there are a lot of numbers being mentioned, and Marissa and Dr. Heflin both said to call the provider first. Then we've got the nc211.org website, and somebody had asked if there were services for hearing impaired on that site. Does anybody know, is the TTY number the hearing impairment number?
That is it, and somebody found it for us.
Okay, and that number, we can also share this chat transcript when we send out the information. So some of these links will be in the chat transcript as well. So the Durham County hotline is general COVID-19 questions. Marissa said that. And then somebody asked, does the applicant for receiving calls fill out a form that allows them to identify their gender identity, assuming a person's gender identity can be made in error and be discomforting and thus disrespecting? Also avoid making assumptions about their relationship regarding family and or friends, either talking with caregiver or the older adult. And of course, remembering that they may not be able to speak honestly due to concerns about the reaction of another person present in the room. Really good points. Does anybody I was going to say, if the speakers, the previous presenters wanted to unmute and just weigh in and comment on any of these questions and comments, please feel free to do that.
I'm going to ask Liliana, a question came up whether the Benefits Enrollment Center, and for those of you who don't know, there's a national effort through the National Council on Aging, and it has these things called benefit enrollment centers, and Duke has the contract in Durham to help Medicare beneficiaries complete forms and do, lots of things that Liliana is responsible for. Are you recruiting folks other than Duke students for the Benefits Enrollment Center, Liliana?
Hi, Gina. For the Benefits Enrollment Center, the actual call center, we are only recruiting medical students. We have other programs under BEC. We are growing a garden, a community garden. So if people want to volunteer for that program, they can always send me an email. And we also have other projects where we go out in the community and we help connect some of the work that the medical students are doing in the community with some of the community members that want to be part of that those projects. So we're bringing those two groups together. So if they're interested to explore volunteer opportunities under the Benefits Enrollment Center, they can just send me an email and I'll be happy to meet with them and explore those possibilities.
Thank you.
Right, somebody else asked if we would be receiving the slides from the presenters, and we'll cover that in next steps as well. But yet the answer is yes. So we'll send the package to everyone. Will there be one flyer for everyone to use to promote the COVID response program? If someone is interested in being part of the program, who should they contact to be enrolled?
This is Gina, and I'll answer that. So there is no COVID, we are loosely connected as a COVID response team, but really the volunteers are going to be supervised by agencies running their telephone reassurance programs. So you, as a volunteer, you'll need to connect with an agency, whether it be the School for Conversion, Meals on Wheels, Durham Center for Senior Life, Benefits Enrollment Center, that's the agency you'll be working with. Melissa is going to be trying to help work with these other potential online directories to match volunteers with where their needs. And we had a couple on the agenda. We had a couple links to where you could sign up for a volunteer. And you can also email Melissa, but we're trying to help match you with agencies that need the help. So there is no sort of new agency called the Durham Partnership for Seniors COVID Response, but Durham's Partnership for Seniors is helping coordinate coordinate that. So Melissa's the best contact. Would you add anything, Melissa?
Yes, no, that is correct. I am happy to receive emails, and then I'm hoping that as we get things kind of streamlined with Hands-On Triangle and the Volunteer Center of the Triangle, that it'll be a little bit more easy for folks to connect with agencies that they want to work with.
We will be looking at volunteers, not just for telephone reassurance, but you're going to have more agencies that need other things, not just making the phone calls. I mean, they're critical, but there are also some other things we understand volunteers need when trying to help older adults in Durham. So if you're interested in that, you'd go through the same route.
Yes, that's correct.
Melissa, you had asked earlier if who answers the phone at the 919-797-9233 number. And I think we heard from Janet about that, but I'm not remembering the her response.
Janet, are you on with us?
I think she said it was like dedicated CEF staff.
Okay.
For the hotline?
Yes.
Yes. The daytime hotline, Monday to Friday, that's listed at the top of the resource directory, is managed by CEF staff.
And then I'm scrolling backwards a little bit because I sort of started in the middle here. Heather asked, will the resource directory be protected since it's in a Google Doc format? I don't see anyone intentionally putting in misinformation, but it would be good to make sure only those who have permission to update it have the ability to do so. And Katie responded that the resource directory will be protected, as the public will have comment capabilities only and cannot directly edit the Google Sheet.
Correct.
Excellent. Were there any questions, more questions from the callers on the phone?
And this is Melissa again, and I did want to share that Marissa had sent over all of the slides that she shared from the health department were also translated in Spanish, and so she had shared those with me. And so obviously after this call, I'll share those resources as well.
If we don't have any more questions, then I'll let you look, Eve, while we're doing. I'm sure all of us can save 10 minutes, but I wanted to make 2 comments just to close this out. Number one, I think many of us, and Mitch hit on it a little bit in terms of racial disparities that are being played out. I think, you know, I'm not unique in this, but a lot of people understand that COVID is really undercover, you know, it's uncovering the dirty underbelly of the growing disparities, not only in income, but wealth in our country, primarily by race and racism and structural racism. And I think everybody on this call, I know the agencies that have been involved in this work, we see firsthand that it's not just individually mediated race or racism that drives a lot of this. It is structural, baked into the system ways, and it's not just about health and access to health care. I heard on NPR this morning, there were, oh, there are racial disparities. People of color don't have access to health care. It's not just about access to health care. If it were that simple, that would be wonderful. It's about health in the ways that we think about it, and public health kinds of ways of thinking about it, which is access to opportunities, access to a good education, access to food, all of the things that we're talking about in telephone reassurance. Your health is way more than access to good medical care. Now, we are so fortunate to have access to good medical care, most of us, after the wallet biopsy, of course. But, you know, that's not the only problem that people have. And I think this COVID-19 is really revealing that. And let's just hope as a community, certainly that's been trying to work on this for a while, that we take this seriously as an opportunity to try to uncover and make headway in Durham with that. And I just want to, if we're closing up, do you have any other questions? Because I want to close with a comment about 2 people. That's it? Okay.
That's it.
Okay, I'm just going to take a little bit.
Thank you to the presenters.
Yes, thank you so much to the presenters and all the people doing this work. And for those of you trying to volunteer, whether you're staff or whether you're volunteering in this effort. I just close it out thinking of two people in Durham. A few years ago, Marissa and team with the Partnership for a Healthy Durham, as opposed to Durham's Partnership for Seniors, which they work closely together, won the Culture of Health Prize from the Robert Wood Johnson Foundation. I was very involved in the partnership at the time and continue to be, but they've just done a fantastic job. And Gail Harris was the health director at the time, and she was interviewed about why we thought Durham should win this prize called the Culture of Health. And she said, because we talk about hard things. And I do think COVID-19 is going to make us talk about hard things and do hard things so that everybody has better opportunity, a better chance for a quality of life, including older adults that are struggling in Durham. So Gail Harris describes it as the Durham way. She says it's messy. You have government, you have CBOs, you have academic medical centers, you have health systems, we have NCCU, universities, and we get into it. We all have different opinions, but I think the thing that I'm thrilled about and feel so fortunate is to be a part of a team where everybody's coming to the same table. This is forcing a little innovation and forcing us to work more closely together, and that feels like a real gift. So a shout out to Gail Harris and the Durham Way. And I thought we'd close just by remembering Marianne Black. Okay. Kimberly Monroe was on the call, so I told her I'd give her a shout out. We want to, Marianne Black, as many of you know, died a few weeks ago. She helped start the Durham Health Summits, where she saw that Duke and Durham community need to get together. And many of us have been involved with those through the years, and it was through her leadership that happened. She was a social worker. She was a county commissioner for many years. She helped start Project Access. Shout out to Project Access of Durham and Sally Wilson and all her incredible collaboration. And Ann Drennan working with the HELP program to make Project Access even stronger, and many of you working on homeless projects with Project Access. Marianne helped get that started. Marianne took the Partnership for a Healthy Durham, it used to be called something Durham Health Partners, and really worked with Gail Harris and inspired many of us to do a lot of work to make the Partnership for Healthy Durham such a great player in Durham. And Marissa, you're largely a part of that. But just thinking of Kimberly Monroe and Marianne and all of the incredible work they've done to make Duke and Durham come together. So we just want to remember Marianne and her social work degree, because that's a lot of what we'd be using on telephone reassurance calls, and hope that we're making Marianne proud by doing it the Durham way. So thinking of Marianne, thank you all for being on this call. Stay healthy, stay safe, stay sane, and be in touch. Thanks, everyone. Take care.
Thank you, Gina.
Thank you, Gina.